Hi, I am Dr. Somasekhar Rao, Senior Consultant Gastroenterologist and Hepatologist, Yashoda Hospital, High Tech City. Today we will talk about a more common problem called dyspepsia. Dyspepsia means indigestion. So, this is the most common cause for a patient to attend our gastrointestinal OPD. Different people have different symptoms, and everyone together they call this as dyspepsia or indigestion. Some people present to us with history of burning sensation in the heart, or there can be excessive belching. They describe this as indigestion. Some people present to us with abdominal bloating, distension and incomplete evacuation at stool. This they mention it as indigestion. Only specifically when we ask for specific symptoms, people come out with all these symptoms. And there can be pain in the upper abdomen and burning sensation in the upper abdomen after food intake. This also people will call as indigestion. And sometimes people have only constipation and abdominal bloating, and even this people call as indigestion. And very rarely people have a symptom of diarrhea along with undigested food particles and sometimes oil in their stools. Even this they complain as indigestion. So, all these things can be termed into a single term called dyspepsia or indigestion, and this is a symptom. So, anyone who presents to us with any one of these symptoms or one or more of these symptoms, we will have to investigate thoroughly for the cause of these symptoms. Younger people who are less than 40, just dietary management like increasing the quantity of fruits and vegetables in your diet and decreasing the oily food, excessive sugars and regular exercise can reverse all these problems, and the indigestion part will definitely go. Even after doing all these things, if someone has persistent symptoms, people who are less than 40, they will definitely have to consult their gastroenterologist and get the disease evaluated and find out the cause. In people who are more than 40 or more than 50 specifically, if someone experiences any of these symptoms which are recent in onset, initial stages should be to get evaluated for any upper gastrointestinal problems. The problems can be in your stomach, in your duodenum, it can be in the gallbladder, it can be in your pancreas or in the large intestine also. So, evaluation is compulsory in people who are 40 after managing their diet, and people who are above 40, even in the first instance you should be evaluated thoroughly by your gastroenterologist to find out the cause and for treatment. Thank you.